Notice, the images of individuals appearing in this video serve solely for illustrative purposes. They may not represent actual doctors or patients. Thank you. Sadistic Personality Disorder, SPD, is a psychiatric condition characterized by a pattern of cruel, demeaning, and aggressive behavior. This disorder, which is often controversial and complex in its diagnosis and understanding, has been a subject of extensive debate among mental health professionals. Although it was included in the Diagnostic and Statistical Manual of Mental Disorders, DSM-3R, it was later removed and is not currently recognized as a formal diagnosis in the DSM-5, the standard classification of mental disorders used by mental health professionals in the United States. The core feature of sadistic personality disorder is a pervasive pattern of sadistic behavior, meaning that an individual derives pleasure from inflicting pain, suffering, or humiliation on others. This pleasure is not solely sexual. Rather, it can manifest in various forms such as emotional, psychological, or physical abuse. Individuals with SPD often have a preoccupation with power and control, and their sadistic actions are a means to exert this control over others. The origins and development of SPD are not entirely understood, but several theories have been proposed. These include childhood abuse or trauma, brain abnormalities, and learned behavior. Some experts suggest that individuals with SPD may have experienced a history of being controlled or humiliated themselves, leading them to seek power over others as a means of coping. However, these theories are speculative, and more research is needed to understand the disorder's etiology fully. Diagnosing SPD poses significant challenges primarily because individuals with this disorder may not see their behavior as problematic and are unlikely to seek help voluntarily. Moreover, the behaviors associated with SPD can overlap with other personality disorders, particularly antisocial personality disorder, making differential diagnosis difficult. The treatment for sadistic personality disorder is also complex and not well established. Psychotherapy, particularly cognitive behavioral therapy, CBT, may be used to address underlying issues such as anger management, empathy development, and behavior modification. However, the effectiveness of these treatments is not well documented due to the rarity of the disorder and the difficulty in engaging these individuals in therapy. In addition to individual consequences, SPD can have significant social implications. Individuals with this disorder can cause severe emotional and physical harm to others, and their behavior can have a ripple effect on families, workplaces, and communities. The legal and ethical considerations in managing individuals with SPD are complex, as they often intersect with criminal behaviors. In conclusion, sadistic personality disorder represents a challenging and largely unexplored area in psychiatry. Its diagnosis, etiology, and treatment are subjects of ongoing research and debate. Understanding and addressing the needs of individuals with SPD, while ensuring the safety and well-being of those around them, remains a critical concern in mental health care.